The following presentation, COVID in Florida, is brought to you by
Anastasia Gliadkovskaya, Manahil Butt, Ingram Chang,
Ethan Pena, and Jay. Epidemiology of COVID in Florida. In 2020, Florida reported over 1.2 million confirmed cases of COVID-19 and thousands of COVID-19 related deaths. Since the beginning of the pandemic, a total of about 7.5 million cases have been reported in the state. January 2022 recorded the highest average number of cases, while September 2021 had the highest average number of deaths in Florida. Per the CDC, the COVID-19 death rate of Florida for the fourth quarter of 2022 was 13.2 per 100,000. As of September 30, 2023, the new weekly COVID-19 hospital admissions in Florida was 6.02 per 100,000.
Early in the pandemic, the leadership from Governor Ron DeSantis was one that downplayed the threat of COVID-19 to the various populations across Florida. While officially the first emergency declaration by the governor was in the beginning of March, there were no restrictions or closures implemented until weeks later. Response and mitigation efforts were initially left to local authorities to implement. Then, a statewide stay-at-home declaration wasn't issued until April 1st, and reopening phases were as soon as May 4th. Early openings were attributed to a prioritization by DeSantis to protect people's civil liberties and constitutional and individual rights. The delays in these orders, early reopenings, along with lax social distancing and masking guidelines, led to significant case uptick and hospitalizations which overwhelmed healthcare systems statewide. Misinformation on the reporting of cases and hospitalizations and the efficacy of social distancing and masking contributed to mismanagement, severe impact on marginalized populations, and nationwide criticism. Public pressure led to a reactionary response to the virus. Like many other states, vaccine access was prioritized for senior citizen populations. Initial partnerships were formed between the Florida Division of Emergency Management and the state's Department of Health, the public supermarkets, to launch some of the first COVID-19 vaccination sites. However, this initial strategy missed other vulnerable groups. Compared to non-Hispanic white people, Black, Hispanic, and multiracial people had lesser turnout in accessing vaccines. Rural, migrant, and inner-city communities also had the least accessibility during this initial phase rollout.
Our proposal centers around improving on the harm to trust and to science that DeSantis has created in the state. We will leverage the media, focus on marginalized communities to help eliminate disparities, and ensure equitable access to public health information and treatment. In the innovation section, we believe the government should know about the latest science by leveraging an advisory team of clinicians, researchers, and scientists to stay informed. To ensure equitable access to treatment, we must consider the logistics, like how can stakeholders be empowered to deliver the interventions equitably. We can leverage resilience by design and resilience by intervention to preemptively imagine what can go wrong and have corrective actions in place, like the use of federal or state stockpiles for supplies or emergency funding. We'll also employ the BRAID model, or bridging research and accurate information through dialogue, to help overcome vaccine hesitancy among Floridians. Evidence suggests that community experts who participate in bilateral dialogues with researchers increase their trust in the vaccine and scientists who create it. Finally, we will focus on interoperability to enable data sharing.
The technical package will focus on adequate surveillance and reporting of COVID-19 data, identification of disparities in COVID-19 outcomes, and the implementation of evidence-based interventions. The Florida Auditor General found that there was missing case and death data and underreporting of ethnic and racial details from the first months of the pandemic in 2020. So surveillance of COVID-19 data should be strengthened, and accessible data about positive cases, deaths, new variants, and rates of vaccination should be reported daily. These should also be stratified by race and ethnicity. Reliable COVID-19 data will reveal disparities in outcomes, and existing vulnerable populations should be identified. Specifically in Florida, the elderly, Black, and Latino populations have experienced disproportionately high COVID-19 mortality. Lastly, the technical package will focus on the implementation of proven interventions, specifically increasing COVID-19 vaccine uptake. Vaccines are proven tools in preventing serious illness and death, and officials should prioritize educating Floridians about the efficacy of immunization.
Ensuring an effective COVID-19 response in Florida entails utilization of various performance management tools. Our goals will include increasing testing and vaccination rates, ensuring equitable vaccine distribution, collaborating with various institutions for vaccine incentivization, funding nonprofit organizations that educate the public and represent underserved populations, enrolling those eligible for Medicaid and having alternatives for those not eligible. To measure the effectiveness of our response, we will collect data on the number of vaccines and related supplies, COVID-19 testing and vaccination sites, percentage of the population currently vaccinated, the number of educational campaigns held and their frequency, the percentage of the population that is insured, and responses to personal experiences during and after testing or vaccination. An online performance dashboard will be accessible on the Florida Department of Health's website and will be used to report and update progress daily. After reviewing the data, we will refine current policies and implement new ones with the ultimate goal of achieving health equity.
To establish an effective collaborative ecosystem of stakeholders across public, private, and nonprofit sectors, we propose implementing the MOCA framework to maintain accountability. This will help to formalize each stakeholder's role in responding to COVID-19 inequities and maintain responsibility to committing to our mission. The partners we are looking to collaborate with will focus on delivering support and services based on an equitable access to testing, vaccines, and up-to-date reporting using gap analysis tools and dashboards.
Another key partnership would be one with the Florida Justice Project, whose mission is to engage in comprehensive advocacy to expand healthcare access and promote health equity for vulnerable Floridians. In the early pandemic and up to March 2022, the Florida Justice Project employed a COVID-19 dashboard which highlighted disparities at the state and county levels by race, ethnicity, and age. Given that Florida missed case death data as well as underreported ethnic and racial details in the early pandemic, a partnership with them would be crucial to bolstering the completeness of COVID-19 data in Florida. This partnership would also allow the Florida Health Justice Project to be a platform for storytelling and education, where stories of public health experts and Floridians who have experienced barriers to healthcare access as well as experienced the failures of Florida to expand Medicaid would be shared to help advocate for affordable and accessible healthcare.
For communication, we want to humanize the impact of COVID by centering individual stories of those affected and prioritizing empathy in our public statements and the healthcare system. We'll engage community members through various events like town halls, webinars, and surveys, and plan to adjust our plans based on community input. In the media, we will lead with evidence-based statements. We'll partner with award-winning newsrooms like the Tampa Bay Times, which is free and accessible, or the Miami Herald, which could serve as critical partners as we try to reach the public. When communicating with politicians, we'll emphasize the vital role they can play in supporting public health, leveraging the stated needs of their constituents. And for funders, we'll highlight the impact of their support with transparent record keeping and explain how their investment directly contributes to lives saved.
To achieve sustained political commitment, we will partner with a few different lawmakers and organizations. We will partner with former Representative Carlos Guillermo Smith and the Florida Center for Government Accountability to advocate for access to reliable COVID-19 data and ensure Floridians are better equipped to investigate public records. Representative Smith will also be a great help in our goal of increasing vaccination rates among underserved populations. We will work with Nikki Fried, the state's former Commissioner of Agriculture, to expand COVID-19 testing efforts for more accurate reporting amongst susceptible groups. We will also partner with Congressman Jared Moskowitz to help overcome vaccine hesitancy and debunk misinformation. As former head of Florida's Department of Emergency Management, Moskowitz played a crucial role in overseeing equitable vaccine distribution. In an effort to improve air filtration and ventilation in buildings, the Biden-Harris administration launched the Clean Air in Buildings Challenge. As a part of this initiative, we hope to work with Sean Hamilton, the Secretary of the Florida Department of Environmental Protection, to reduce the amount of infectious aerosols indoors, thereby helping to reduce the spread of the COVID-19 virus.